When examining the woman's abdomen, you will usually be doing this in the early part of her pregnancy, so her abdomen or her uterus will not be full of a larger fetus. So you'll be able to palpate quite easily. If you have a client that comes in late in pregnancy, it might be a little more difficult to do this exam as we're describing it today. So in your mind's eye, divide the abdomen into 4 quadrants. So we're going to do each quadrant separately. When you do this, it helps you to be able to differentiate where you're finding, if you did find a mass or a painful area, then when you're recording it, you can differentiate where you're finding that, in which quadrant. And it also helps you to do a more thorough and systematic exam. Whenever you're doing something in a systematic way, it's easier to do a good job and a thorough job and not to miss things. Okay, so that's one of the reasons why we do that. So after you've divided it into the 4 quadrants, you want to start with one of the upper quadrants. I usually start with the upper left quadrant, which would be where the spleen area is. And you'd want to palpate that entire quadrant. And when you're palpating the spleen area, you might want to ask the mother to take a deep breath. And when she's taken a deep breath, then you're going to want to push down with a flat palm of your hand underneath that rib, that lower rib. If you can feel her spleen, that means her spleen is enlarged. If you can't feel anything, then that's a good sign, because the spleen, we do not want to see the spleen enlarged.